Good morning, Lake Providence Church family and friends. Thank you for joining us today. This is Dr. Linda Plummer Ward with another health ministry update. I trust that you are doing well. So let's talk about fully vaccinated people and the new CDC guidelines. Fully vaccinated people can visit with other fully vaccinated people indoors without mask and without physical distancing. Fully vaccinated people can visit with unvaccinated people from a single household who are at low risk for COVID-19. And this can be indoors without wearing a mask or physical distancing. So what did I just say? It means that if I'm vaccinated, I can visit with someone who is not vaccinated, but they need to be low risk. That means they don't have any of the comorbidities. They're not 65 and older. They're not younger with those comorbidities. And comorbidities, they include heart disease, lung disease, obesity, diabetes, all of those things that we've been talking about, immunosuppression. For whatever reason, they may have comorbidities. If they are at increased risk, we want to take precautions. But if they're not, we can visit with them without wearing a mask or physical distancing. That's people from one household. Fully vaccinated people can refrain from quarantine and testing following a known exposure if they remain asymptomatic. When fully vaccinated people, like anybody else, starts to get symptoms, they need to be tested and then govern themselves accordingly. If the test is positive, they isolate themselves. If it's negative, they may want to quarantine if they have symptoms. So, for fully vaccinated people, here's other guidelines. Take precautions in public, as always, wearing a mask and doing physical distancing. You want to wear a mask and do physical distancing and adhere to all of the preventive measures we've been doing when you visit unvaccinated people who are at high risk. So if they have comorbidities, they're over 65. If they have comorbidities and they're less than 65, you still want to take all of the precautions because these people are at risk for severe disease. If they have a family member or a household member who's unvaccinated and also at high risk, we still want to take all those precautions that we normally take with mask and physical distancing, etc. You want to do this also if you're with a group of people who are from different households. If you're vaccinated and you're with people who are unvaccinated and they're from multiple households, then you need to wear a mask and do physical distancing. Avoid medium and large crowds as before with in-person gatherings. Get tested if you experience symptoms. Follow guidance by your employers at work. Follow CDC and health department travel requirements and recommendations. And let's talk about travel just briefly here. If you must travel, protect yourself and others from COVID-19. If you're eligible, get fully vaccinated for COVID-19 and wait 2 weeks after your second dose to travel. It takes time for your body to build up immunity, as we mentioned. Get a viral test 1 to 3 days before you travel and keep a copy. There's going to be places where you're going to be required to show proof of vaccination, especially if you decide to go to Europe. They're working on that now. Do not travel if you test positive. Check the travel restrictions of your destination so you'll know, you'll be able to anticipate these things before you get there. Wear a mask over your nose and mouth in public settings. Masks are required on planes, buses, trains, and in most places, U.S. transportation hubs like airports and stations. Avoid crowds and stay at least 6 feet, which is about 2 arms length, from anyone that you didn't travel with. That's whether you're indoors or out of doors. Wash your hands and use hand sanitizer with at least 60% alcohol, and bring extra supplies of mask and hand sanitizer. Avoid contact with anyone who is sick. Avoid touching your eyes, nose, and mouth, and do not travel if you were exposed to COVID-19, if you're sick, if you test positive for COVID-19. Learn when it's safe for you to travel and do not travel with anyone who is sick. After you travel, the CDC recommends that you get tested with a viral test 3 to 5 days after you return and stay home and self-quarantine for 7 days. If you test negative, then the 7 days should be sufficient. If you test positive, then you need to isolate yourself to protect others from getting infected. If you don't get tested, stay home and self-quarantine for 10 days after travel. Avoid being around people who are at increased risk for illness for 14 days, whether you get tested or not. I hope this has been helpful. And as always, stay safe, stay healthy, and stay prayed up.